So I'll get right into it. Alison Sonstelie is a client success manager at Ascendo Health, where she helps clients leverage data to improve their operations. Prior to joining Ascendo, she worked in sterile processing and supply chain for over 10 years. During that time, she was elected to the HSPA Board of Directors, was part of the 2014 Healthcare Purchasing News CSSP Department of the Year, and participated in several AMI groups. John Erickson is a sterile processing veteran, over 18 years, beginning as an entry-level technician and advancing to roles of educator and manager. With each successive role, he saw how the need for measured outcomes became increasingly necessary. He used pertinent information to improve departmental operations and resource use. Please help me welcome Alison and John to the stage to discuss the instrumental role of data analytics.
All right, can you guys hear me?
Yeah.
All right, thanks for being here bright and early on a Monday morning in Las Vegas. Appreciate you guys being here. I'm Allie. So one of the great reasons about coming to HSPA is that you get to, meet new people, you get to talk to people you haven't spoken with before. Maybe it's your first time here. Maybe you are struggling in your department and you feel like you're crazy every day when you go to work, and then you come here and you talk to people that also feel like they're crazy. So it's great to kind of have those experiences that you can say maybe it's not just me, maybe it's other people. So one thing that I've always found, and John has found as well, is that when you are having those really kind of chaotic moments, or you're feeling like this isn't right, something's wrong here, we can maybe do this better, the one thing that's really going to help you in moving and improving is data. So if you can find a way to gather data, you can find a way to interpret it, share it with people, it's really going to make a big difference as far as taking some of that chaos that you're experiencing every day and turning it into something that's better. So that's really what we want to share with you today. There is a chance at the end to have questions. Also, I encourage you guys, if you want to share with the class, things you've done with data or projects, things like that, I think that would be great. So I think we'll have about 15 minutes at the end. I always feel like HSPA does such a great job of putting together really good educational content, but there's 1,500 people here. And if you think about all the years of experience in all of those 1,500 attendees, and just that wealth of knowledge and experience that's here in these rooms, it'd be really great if you guys can go out of your way to share and talk to each other and learn from each other. One thing that we struggle with in this industry is there's not really good benchmarks for data. There's not a standard, productivity metric that you use, or a standard, how many errors are acceptable. We don't have that information. And so John has experience working in departments that started with nothing, and so he's going to share a little bit right now about that.
Good morning, everybody. My name is John, and I currently work with Endeavor Health Systems in the Greater Chicago area. One of the impetus for wanting to talk about this was an interview I had a number of years ago for a manager position at the facility. And what came out during the interview that they couldn't tell me how many trays they did. They had no idea. They didn't know what their defects were. They knew there were problems. They didn't know exactly what these things were. So experienced this then subsequently on multiple occasions, where people tend to believe that they need a tracking system to be able to acquire metrics and to maintain their data. That's not the case, and we'll kind of go over some of those things that we did to get that started. So what we're going to try to do today is provide definition of data, demonstrate its importance in sterile processing, look at some key performance indicators in the department of sterile processing, and then discuss methods for collecting data through both paper and automated tracking systems, right? And how to maybe take that real-world data and make it into usable and things that we can help with our departments.
All right, so just like we don't really have standard benchmarks for the industry, we don't really have standard definitions for things either, so you may hear us mention these things, but these are just some different ways to talk about all of the things that are in the department. So instrument, anything that is expected to be included in a finished product. products. That could be, you know, a single instrument, a tray, a set, a container. We hear those words kind of used interchangeably. Peel packs or singles, again, totally different than a set. You know, it's a single item, and sometimes those things are treated the same when it comes to productivity, but it's important to note that they're two very different things. Again, item, same thing kind of as tray or set. And then a defect, that's an important one. That's any reported deviance in a product from the user expectation. One thing to note, and I think John mentioned this as well, sometimes you may think that like when you hear analytics, you hear data, you hear reporting, you think you may have to have a tracking system to do that. While having a tracking system is great because you can automate those reports and see exactly what you want to see, you can still do this stuff without a tracking system. It just takes a little bit more manual work. I was sharing with John yesterday when I took over my manager role, the woman that I took over for didn't have a chance to clean up her office. She had a 3-person office. It was just her in there, and she was like a hoarder. So she had all of these printed emails, things that they were tracking manually, like stacks like this high, and it was like, who is going through this? Nobody's actually doing anything. So staff were like tally marking things and recording stuff, and then nothing was happening with it. It was just sitting in these piles on her office. So it is possible to look at this stuff without a tracking system. Like I said, it is helpful to have one. But it's just understanding what exactly it is you're trying to track, and then having, you know, a good method and a good process in order to do that and make sure that you're actually, you know, inputting this information and looking at it. And then John is going to go over, you know, these bullet points and how he has done this in the past without a tracking system. So again, really good examples of things you can do from having nothing to coming in, taking over, and then kind of deciding what you want to look at. But these are some important things that you might want to record and track.
So that interview that I had, I accepted that position. So we didn't have any metrics at all. There was no method of gathering anything. So what we started to do was utilize our sterilizer records. And we had to go over every day and double check those records to make sure that everything was accurate and the quote numbers matched up and everything. And as she was doing that, I made up a sheet where she would just put some totals in there. So she would put in total trays, total singles, and we do that between both steam and low temp. I would take those every day and I put it into a spreadsheet, right? And then I could add everything. The other thing we were able to track outside of volumes was our defects. So the OR would report our defects to us, and then just come up with a simple spreadsheet. Keep track of those, they weren't that tight. And eventually we come up with quite a bit of stuff just on those two things. So this is just a look at some basic volume in items, right? It's any finished product that we might take. And this was accumulated over the course of the year. One of the interesting parts about it, though, is when you look at, say, July and August, in there you can see that August has a greater number of items. So you would think that August was busier than July. An important concept is calculated by business day. And business day is how many, basically, how many days the operating room is actually in normal operation. So it would not include weekends, it would not include holidays. And those can flux throughout the course of the year. So July this year might have a certain number of business days. July last year might be different. It all depends on when the weekends fall. So if we look at it as a by business day, volume by business day, you can see that August was actually substantially slower than July was. Right? So one of the things we want to do with numbers, we want to be able to compare them. Right? We want to know which month is busiest, which month, how we're doing this year versus last year, whatever it might be. And that's one way to kind of equalize that volume numbers by doing that. And if we look at that represented in this basic graph, the blue is just the gross number and the orange is the per business day number. And you can see that August not only was it slower, even though it had greater volume, I believe 5 of those previous days, you can see it was the slowest month that we had on a per business day look. So that can really change things when you look at things year over year, month over month. sometimes we might miss a recording of it, or the OR might not actually report it, right? So that can throw our numbers off. So we always want to make sure that the OR understands that we do in fact use those numbers. If they do have a meeting to us, we'll present to them, this is what we found, this is how we get better, this is where it's going away, so that they know that that reporting is actually being used, and it's not just a hassle for them, right? And we want to know what specific items, what the specific issues are. We want to just be able to track it all, you know, and a lot of times we see them returning count sheets or returning labels or wraps or something else that has all the pertinent information on there that we need. And then we want to be able to track all of these by type and that sort of thing. So just looking at a quick look at defects in a hospital I was in some time ago, you can see our number one problem there is that no indicators. And you can see that was actually something that increased, followed up by reported dirty instruments and down the list. Right? So we now know at least where we want to focus. We want to be able to provide the OR with a quality tray, quality item every time, and we know specifically where our defects are coming from. Right? When we look at defects, you can see the monthly fluctuations in there. Another way to be able to compare those across each other is by making sure you're doing it by rate. And so a rate that was taught to me years ago was looking at it as a defect per 1,000 trays, right? And this gets our numbers. We do, if you look at the bottom, you see that accuracy percent. You almost don't see any difference amongst those numbers. They're just two, 99-point stuff. Just seems like it's 99-point stuff. If we go to that rate by 1,000, you can see that in February we had 1.42. In June we had 2.94. You know, June was actually twice as bad. Whereas if you look down at just the accuracy rates, it was 99.86, 99.71. That seems like the same number to us. So trying to put that in the rates, but by, in this case by 1,000 trays, and there's the equation for it. It's just restating the same number, but it does it in a way that makes it more useful.
Can I add something to this
You
too?
certainly can.
So I know that a lot of us here, like, this always happens, or this is never right, right? You know, you hear that a lot. You can see that 99.83% of the time it was right in January. So having this information, a lot of times we get like it's a lot of emotion when things are going wrong in the OR, like things get really like heated. And so then these, statements come out, then there's meetings afterwards. You don't have this kind of information where you can say like, hey, we're actually getting a lot better, or we got a little bit worse this month, but we're still, over 99%, providing quality products to you. I think is really helpful when these really emotional conversations get introduced into your department.
Yeah, to follow up just a little bit, though, there are three things that go into those numbers. So if they're not reporting back to us, at some point that becomes on them. This is what we know. But we have to make sure they're being recorded when we do get them. And then just that put into graphical form. You can see in this case volume's been sliding just a little bit. And our defect rate is actually increased with that number. So something that we'd want to look into right there. So we're going to look at, again, it's all about comparables and how we're doing over time, some trends. And in this case, we'll just look at comparing year over year. Right? Year over year calculation is relatively simple. It's this year's number minus last year's number divided by last year's number. Express that as a percent, and you now know if it's up or down or how much. Right? So as the examples on there are pretty simple. We did 100 trays. This year we did 90 last year. We did 100 minus 90 divided by 90. That equals 10 90ths, which would be 11%. If we reverse them, they'll come up -4. So if we got slower, you see we'd be minus 10% the other way. And then just to show, that change for, say, cases in this case, cases compared to the previous year, you can see those numbers crossing. And the blue line, which would be this year's number, so to say, is actually where we're up somewhat over last year. So So knowing that when it comes to budgeting and what you need for staff and that sort of thing becomes pretty important to be able to track that and make your case. And you can put it all together into one big old sheet that's all color coded and everything, and on different volumes with cases and trays, and yeah, defect rate there at the bottom. We're doing this without a tracking system, so it's very doable. It becomes excellent information. You can see if you're getting better or worse, what your if you're doing projects, are they improving or not. But whenever you look at numbers, you want to make sure they come out as expected. Anytime they don't come out as expected, you want to maybe dig in and find out why. Right? We should have a feel. If you do this enough, you get a feel for what it should be. We should be busier this month. It's felt that way, or it's we run somewhere in this range of defects every year. Then if it goes way up or way down, maybe look into that. And this is a case of that. When we look at our in October versus the previous October, everything was up in year 2 October. But when you look at the numbers, you can see the cases were up 12%, trays were up 10%, instruments were up 14%, the items were only up 5.5%. Why would my item be less than everything else, right? So that immediately sticks out as an issue that maybe you want to find out what's going on here. And in this case, it was a project that was started after last October and is still going on, getting single pack instruments in the trays. Right? So we were reducing our number of items, instruments went up, just still basically processed every time. So part of the time we did reduce items, and I don't think we had to pull. But you see that pop up and you're not sure why, so you want to ask a question or two. Yeah.
I think you guys have probably heard about like asking the 5 whys. So you see something like this, your first question would be, why is that number different? Usually that 5 why rule, like if you ask why 5 times, you'll probably get pretty close to the root cause of why that's happening. So again, having these numbers and where you can see trends, you can compare them to different points of data, is a really good place to start looking at things and to start asking why things are happening. Do you want to advance to the next slide? A lot of times people think when they implement a tracking system that this data is just going to somehow magically appear and they'll have all these reports that they can run and it'll just show up, right? Like it'll kind of take care of everything. What we see though when we look at tracking systems is it's really important to understand what's important to you, what data do you want, what kind of strategic scan points do you want to implement. There's such a thing as too much scanning. So like, again, we talked about that manager that had like the stacks of paper where people were tallying, like, oh, we're running up to the floors, I'm tallying it. If nobody's looking at it or doing anything with it, what is the point of doing that? So again, like some of these scan points that people want to kind of implement are great in theory, but if there's nothing happening with this information, it's kind of just extra work for the staff. Again, another thing too, hardware to support those workflows. Sometimes you may see like, why are people scanning in Deacon Town? Well, there's only one scanner and there's 3 people working back there, so the other 2 people can't scan anything. It's some of these simple things, again, asking why, trying to figure that stuff out. It really helps you get down to some of these root causes of why these things are happening. John, do you want to go to the next slide? And so a lot of times when you are if you have a tracking system, don't have a tracking system, you want to start tracking data, start looking at things to improve. Once you find those little, nuggets, or you just have a gut feeling of something that you know could be better, that's when you want to start gathering data that's going to help support your very specific strategies. You want more staff. How are you going to start gathering information to help prove your point? You want to reduce your IUSS. How are you going to start gathering data to start doing that? Maybe you want to reduce the number of missing instruments that are in your trays. How are you going to look at that and try to move the needle that way? Can we go to the next slide, John?
So just a real quick one on IUSS rate. This is one from a place years and years ago, where we used IUSS rate as a number of IUS cycles by the number of cases to come up with the rate. And if you look at July, August, and September, October, very, very high, right? And then suddenly it just drops off. That was an implementation of a project that occurred. And you can see the numbers that immediately stayed low thereafter. But if we look at the graph, the first one, the last 14 months, shows that big drop that we did, right? It looks like everything's going along very, very well. But if we change the scale of that graph, and we look at it just in the last 9 months, and take out that big drop, we can see what's happened, right? We're starting to drift back into older ways, right there. So making sure you're checking scales and things like that throughout will really give you useful information. And then so at this point, you might want to do another intervention of some sort to bring things back into line. But when you look at the first graph, it's hardly noticeable.
And then on the next slide, we have the same type of information, but this is coming out of a tracking system. But as John mentioned, you look at the graph, and it looks kind of dramatic, like the bars are really going up and down. This could be the difference of like 1 or 2 items that are IUSS or not. So it's really important to understand what that scale is when you're looking at information like this. Do I go to the next slide? And obviously, when we talk about IUSS, you're never supposed to IUSS because of a lack of inventory, although we know sometimes that happens. It can also happen because trays are wet. And so if you want to get a better understanding of why you're doing so much IUSS, it's really important to know what it is that you're doing IUSS for. So being able to see exactly which trays, do we need to have more inventory? Is this a wrapped tray and it has holes in it all the time? Should we move it to a rigid container? Should we look at where it's stored? Is it, on a shelf that's kind of sharp? Is it wet because it's got a lot of metal mass? It has plastic trays in it. So again, you see this information, you can start asking like your whys for each of these items and start picking off some of this low-hanging fruit to make a really big impact in the OR.
One of the things that's happening across the industry is we're really starting to centralize a lot of the processing that goes on. So a lot of places I'm associated with have been adding a lot of clinics into their reprocessing numbers. And that's going to affect what we need, right? So OR bases, we have those clinics, we need more resources to be able to deal with those clinics. And this is just a look at something you can do, just clinic items as percent of your total, right? You can see how that has grown substantially over time. This kind of thing you would want other numbers with, what are my totals, make sure it's not my OR going down, right? But OR is growing, and the clinics are adding on. We've gone from 14% of everything all the way up to 21. So that's a big increase in the amount of resources we're going to use. Is something that we can utilize for justifications. More and more things.
And then this one's, you can kind of see this one, but this is, again, another example of out of a tracking system. So in addition to having the amount that are going to the clinics, it's just adding an extra layer of knowing which clinics they're going to. So some places will bill clinics for all of the devices they're reprocessing for them. Or, it's just an opportunity to look at which clinics are we having the most traffic in and out of. Just, again, having that awareness of how these numbers are changing over time. And then we did mention missing instruments. Missing instruments are a huge opportunity to do some process improvement. A lot of places have backup instrumentation that they manage, which can be really, really difficult to manage. I've seen in a lot of big places it just is like drawers and drawers, and it's unorganized and things are missing, and it's hard to manage that. But having better understanding of the amount of instruments that have been marked as missing in assembly is really important. John, if you want to go to the next slide. Here you can get down into some deeper detail. Again, why, which trays are they? I can see exactly, that set basic cataract is like the big heavy hitter right there. So what's going on with that tray? Why are things marked as missing so much? And then on the graph to the right, you can see exactly which instruments have been marked missing. So if you're looking at your backup instrumentation wall, do I need to have more Mayo scissors on that wall? Do I need to put different needle holders there? It just gives you a better chance to have some more insight as how to manage that inventory so you can send complete trays to the OR.
So, we're going to try to put everything all together right here into one big mass. And it's looking at quality assurance program. When we started off, we were just looking at volumes and defects. Now we're going to look at steps, right? And we're going to measure our steps in the process to make sure those are being completed accurately. And so we're looking at an endoscope quality assurance program. And when you look at that, you look at the steps, and we've been going over this a couple of years. Pre-clean, zone transfer, weight testing, etc. We want to measure those to make sure that everything is getting done in accordance to what our process is. Because it's through this whole process that we should end up with a quality product at the end. Right? So if we know that each step of the way is being done properly, we can rest assured that our end result is exactly what both the users and the patients require. Right, so first thing is they have to come to us, they have to be pretty clean, right? So this is a look at incoming non-conformances is what we call them. So those things that weren't pre-cleaned right, didn't have a biohazard label, whatever those defects were. And we want to measure those, get feedback back to the user areas so that we can know, they can know how to better improve their process. At this particular facility, it's a very large facility, so those numbers are actually pretty good because it accounts for about 25,000 endoscopes in this case. So they were really involved in the process, and most of the issues came from residents. Anybody believes that? So we're going to look at our later processing has become a thing, where when we don't start our processing on it within an hour of the pre-clean time, then we have to go and delay, do an extended soak. Takes a lot of work, a lot of time, and damages our scopes. And you can see here that we had a huge spike, right? And so we need to figure out what's going on with that. We need to identify that as an issue. In this case, it was a large facility, and we were adding more units into our area, more customers. And what was happening was that so many scopes were coming in at once that the older scopes were getting piled below the newer scopes, and so the older ones were getting delayed, weren't in a timely fashion. So we need a resource. We used a resource that they could do the sorting, they could do the seeding of everything, get it to people, and you can see that worked. It actually got us back down to what we call a baseline number. Right? So keep an eye on that one for spikes. We were measuring this, staff don't really think about it. They just think the way it is by constantly keeping an eye on these things. You can see it, even if it's not really noticed. In this case, when we lead test and that, if they fail, we go off for repair. The reasons, of course, we go off for repair. Checking that, checking our trends, it's going to test our handling, test our cleaning, make sure that everything being done properly in that regard. In this case, you see very high in the reader scopes. That was actually due to a recall that they had on the bending section at the bottom end. So that would have been expected. To see that, and then you can see everything else on there is maintained relatively. Though it looks like about every 50 to 60 uses, something was going out at that time. Helps you with your repair programs and all that. So in this case, every single scope got verified with ATP tests. This is a look at our failures by scope type. Again, over a very large data set. One of the, and this I've seen, this is general, whereas duodenoscope, gastroscope, monoscope, in that order. I've seen that in multiple facilities, numbers are different. Seems to be a common thing that way. I had the manager of this department one day called me up and said, for the first month, this is the first month we've had 0 on this number. And I immediately red flag. We've never had 0 before. It's not been close to 0. It's always been about And it turns out that a newer staff member was doing the quality station, doing the quality checks and ATP testing, and they in their head thought that they wouldn't see, we had 2 scans that quality pass, quality fail. And every time that it failed, ATP, you're supposed to scan quality fail. Well, she wasn't, she just sent it back to the desk, or to the sink. And then they were cleaning it, and she'd scan a pass, and once she got a pass, and then put it through the window to the next step. Thinking it just needed that pass documentation to go through, which makes sense. So we did a little retraining on her, and things went back to normal. But the thing is, again, can't be overstated, the numbers need to make sense. And sometimes they look a lot better than what they should, sometimes they look worse. In general, I did, by doing this regularly, get a pretty good feel of what those numbers should be. So another thing we tracked are failed AER cycles. You can see again, that first spike, that's the very beginning of it, was a brand new opening. Anybody's done new construction on these kind of things, you're always going to have some problems with backflows and temps and things like that until engineering gets that worked out, which they did. And then it spiked back up. So something was going on. Initial thoughts engineering. Engineering said, no, we checked everything, it's fine. It took us 3 months to figure it out. We presumed it was maybe some staff issues with servicing as we're trying to figure out exactly what it is. In 3 months, what we figured out finally was that it was a block. It was a cleaning block that had an old gasket on it, and it would pop out all of a sudden. Every other block we had was a snap-in. Done. And this one just had to go over. And again, some staff weren't noticing. Nobody was reporting there's problems here. You see it in the numbers. Right? And so we're able to contact our vendor rep. He sent us a new one for that, and you can see the problem went back to baseline. So getting course and tracking everything, right? And then of course you can track your staff along with all of that. And we do that. See who has the defects that get reported or whatever. In this case, it's Alison and John, and in this case, John needs some retraining. That looks like right here. Right? So 14 out of every 1,000 scopes that I sent out were defective in some way in the cleaning process. So it learns you, of course, to where you need to focus, whether it needs to be retrained or what the problems might be.
Looks like I should be training you in this example.
So retraining people.
Knocking it out.
We'll start with it.
Right, so, okay, in conclusion, establishing and maintaining a robust system, and that can either be a tracking system or just your method and process for tracking data. To monitor key performance indicators is important to improve the quality of your outputs and effectively manage resources. I promise that this was not a sentence written by AI, although it looks really AI-ish when I look at it now. It's right off the top. But so what does this mean? So we mentioned that if you want to start having a better program for managing your key performance indicators, we mentioned that there is no industry benchmark. So we have nothing to kind of guide us as far as what's good, what's bad, what should we be looking at, right? So you have to get an understanding of what your current state is. So pick a few things, like 3 performance indicators that you care about, that you want to track. It could be defects, it could be productivity, missing instruments. Start with those 3. Figure out how you want to track that information, whether it's doing it manually, putting it into an Excel spreadsheet. You have a tracking system, you want to implement some new scan points, start using different things in your tracking system to actually do it. Train your staff. Make sure that they understand the importance of why they're doing the things that they're doing. And then at the end of the day, you have to be willing to be influenced by the data you're seeing. Sometimes you may think like, we have these defects because the OR is always sending things back to us with like bioburden, and this is what's happening. And as you start gathering information, looking at trends, you may find out that what you were thinking and feeling was actually wrong. So you do have to be willing to be influenced by the data that you're seeing. Again, it's important important to ask why and verify it, but you do have to be, like I said, willing to be influenced by it. That kind of wraps up our presentation for the day. As I mentioned, we have time for questions, so there is a microphone here if you want to step on up to the mic. Or if you have something you'd like to share with us as far as like things you've done in this nature, project, process improvements, would love to hear it. Oh, I think you have to, it's hard for the people in the back to hear if people in the front ask questions.
Good morning.
Good morning.
Nice presentation, thank you. I just want to say that I do not work for a tracking system. I work for a healthcare system right now. But from my experience, an instrument tracking system is a critical need for your departments. That said, I know budgets are tight, and I'm working with a couple of organizations that do not have tracking systems today. And what I would recommend is start. So I appreciate the manual perspective, because if you start manual and track it, you will see how much time it actually takes to track it manually. You'll see that there will be errors. It's difficult to figure out tracking today trays with missing instruments. That seems simple, but if you think of all the places your trays can live, it takes us a really long time to manually count that. If we had a tracking system, that data would be there for us to look at any snapshot we wanted to. But we're starting small, and then we can say, we can show that value to our teams, to the OR for tracking quality events. That takes a long time to do it in a spreadsheet, but once you start seeing benefits to that, then you can say, perhaps you need an agency to come in and help because your leadership team is doing all of this manual tracking. So as you go through this, then you're demonstrating, I need a tracking system, and it's actually saving money. There's a return on your investment with the tracking system because you have now all of these data points, and your leaders can make decisions on that data instead of collecting all of it. So start small, start manual, but that will help justify the need for a tracking system, which I do believe is critical. So having been on both sides, I just want to share that side of it because I know budgets, we hear tracking system and sometimes people just shut down. I can't do that. Start somewhere. But thank you, I appreciate it.
Thank you, Courtney.
Thanks, Courtney. Yeah, and somewhat to that, if you're going from a paper system into a tracking system, you're going to work very closely with your vendors. They have a lot of experience in this, will be able to help you out. You're going to have your own ideas. Some things work, some things haven't. They're the ones that are going to know kind of how that's worked in the past. So work closely with that group.
Good morning.
Morning.
So now as more and more institutions are going to tracking systems, whether it's manual or automated, do we think we will have benchmarks anytime soon?
I think there needs to be some agreement on definitions of things before we even get to that point. When we even talk about defect rates, are we doing it by case? So how many defects per case? Are we doing it by tray? Are we doing it by instrument? We have to come up with some of these definitions. I love that idea. I hope we get there at some point. I think we will, but I think right now, we don't even know what to call our own departments. Like, we all have a different name for our departments. So I think we just need to, we have a lot of groups in HSPA, we have our Amy work groups, even AORN. I think some of these groups can come together, and I know there's been some charges up the hill to try to do some benchmarking work that just kind of, fell flat. But I think, as we mentioned, with more and more information out there that's so easy to extract, I think it's going to be really helpful to start building those benchmarks up.
And I would say also that Amy had attempted to make a benchmarking tool maybe 10 years ago. And it just really didn't work quite well because, again, the difference in terminology, the differences in there, and that. There were some good ideas in there. One of the things that I do put in is a complexity level for the tray. And they kind of gave some guidelines in that one, what to do with that. And when we get to complexity, it's not necessarily just assembly complexity, it's resource per department. So like a vendor tray would take up so many layers on a washer rack that would have a higher rate than something else. And in that way, I think there are ways that we have that we can become somewhat comparable. But you have to have standardized. It's fairly subjective working those numbers right now. You have to have some standardized for that.
Good morning. I you guys changed your data from the 99 percentiles to the per 1,000. That's one thing that we're really struggling with is that's such a high number. We're not seeing much fluctuation. There's not much area for improvement there. In terms of what you're tracking, or the goals for your defects per 1,000, is there some number you're shooting for to get below, to stay below?
Not really. You kind of take your baseline wherever you're at right now, and you want to get better, right? You can set kind of whatever goal you want. Once you attain that goal, then you probably want to get better again, right? So continuous quality improvement. Specific number. I mentioned a place that I interviewed for that didn't have the weren't gathering metrics at all. Our goal is much higher than what it's been in some other places. So we got a lot of work to do there.
I think one thing to add too, I think you mentioned this earlier, but a lot of times with the quality reporting, it's really at the whim of the OR to tell you when there's a defect. So sometimes you could be like, wow, we've had this huge drop in our errors, but it could just be because the OR was busy or they had new people that weren't reporting, things like that. I think that it's much more reliable to depend on doing audits of your inventory and things that you're looking at, and that way you know for sure, like I have this sample size, I went through everything. It's not like you kind of take that risk of under-reporting away and you get a better, like true like quality rate, I think, by doing audits. And audits are hard because it's like, who has time to do that? But it is, if you want to have just another kind of layer to look at, audits are really important to do that. Hi.
Morning.
I have a number of things I want to throw out there. So my system is a system of safety in hospitals. So, and we don't have tracking systems, and budgets are extremely tight because of the communities the servers are, basically indigent. But I loved your presentation because for the last 4 years, I have been doing almost exactly the way you set it up. And I'm so gratified to find that I'm not the one doing it. A couple of things I want to say. So for consistency across my system, because I have a big, trauma center hospital with 24/7 with 12 ORs, and I have other ones that only have 4 ORs and only work during the week from 7 to 10. Using the 1,000 tray is still a little difficult for me because for consistency. So I dropped it down to 100, and I use that as my number. I also found that it was really helpful for me in my monthly meetings with surgeons to track the total number of instruments per tray and to be able to correlate the trays that we're processing on a daily basis and come up with a monthly figure of total instruments processed. And then using that to connect with a time study that I did. So if I took my most efficient workers, my least efficient workers, and somewhere in the middle, come up with an average amount of time, and then correlate that to the time it takes to process the instrument. So I have data that when I go to these meetings and the sorts of, I don't understand why it's taking so much time. Well, here's why it's taking so much time. And I invite them anytime you want to come down and watch, or even participate, I'll be happy to sponsor you. So that's worked really well for me. And also, I was able to kind of get one of my techs to participate in tracking all this data because one of the things, it takes time. Who has the time to do it? Inputting that data manually takes a lot of time. And then trying to do the analysis on it, that takes a lot of time. But I also found that being able to do that helped me correlate to usables for my consumable items and to be able to track that better. So that way, as you brought up with the clinics, because all of a sudden we're getting an influx of more clinics, be able to justify either having chargebacks to them or having my budget increase. So, and also, one of the things I wanted to ask about, you talked about the repairs. Have you, is there any consideration for tracking the type of repairs? Because Because, you know, that's one of the issues that comes back to me, like, you know, the cameras, I get them coming back a lot, and then they'll say, well, what are you guys doing? And I'm saying, well, according to the reports I'm getting back, it's all from the end. The cable keeps getting pulled out of the plug. So, are your surgical techs removing it by holding onto the plug, or are they just grabbing the cable and yanking them out? Because like 90% of the problems are from the cable. So it's not my end, it's your end. So that helps, that kind of information helps have that conversation. But I didn't see any kind of categorization. I'm just curious if you guys.
Yeah, there was so much here, we didn't know where to go about so quick.
Thank you.
So we could have gone into much more depth.
Thank you for sharing all of that.
But that was,
I think one thing to point out too, like you mentioned conversations with surgeons, like at the end of the day too, they're like scientists, so like if you have a bunch of data to show them, and they're like, oh, like what is this, and they can see all of the work and all of like the numbers behind it. I think not all of them, but sometimes they get really like interested in what's happening, and then they'll like, you know, they understand and they'll like kind of fight for you. So I think it's great that you have those conversations with them. Yeah, yeah, exactly. Instead of nothing else, it quiets them down.
yeah, when it comes to the surgeons and that, they tend to have a preconceived notion of sterile processing. And when you can come back at them with actual numbers, data, charts, and these kind of things, they can oftentimes take it back just a little bit because they're not expecting it. Right? And you're saying this is happening, this is what everything shows. Right? So, very important. We appreciate all those questions. Those are awesome. Anything else, anybody know?
John, how often are you analyzing the data and looking at it? And does that change when you're doing it manually versus a tracking system, the amount of time and the frequency at which you're looking at this info?
So the frequency of actually looking.
So the question was, how often are you looking at it, and is it different manually versus a tracking system? Okay, sum it up.
Yeah.
Okay.
Yeah.
It's going to all depend. I mean, everything on a high level is looked at monthly. We go through if we have specific projects or things going on that we want to, more real time, we look at that. Possibly weekly, something like that. Even daily, we take a peek and make sure things make sense. But in general, it's monthly. This is how I look it up. Makes my year-over-year comparison.
So you can still ask questions, but just to respect
We're getting
everybody's
close.
time, we're at time. So
Okay.
and they're still available for questions.